Today, we're going to be diving into a rather fascinating and controversial plant medicine that maybe you've heard about to help trauma and addiction, and it's called Ibogaine. I've had people asking me to talk about Ibogaine for a while, and so we're going to dig into it. I'm very big on providing what we know as facts, and then I'm more than willing to share stories that have personally been shared with me regarding benefits from it. What I keep hearing in regards to Ibogaine is that it's a game changer. And on the flip side of that, you have others who say that it's a very dangerous medication to use. It is a psychedelic. And if you've ever had a bad trip in my youth years, I'm lucky that I didn't. Well, some of the claims are that with just one treatment can help people not seek out that drug. All the things that I've heard about Ibogaine is that it's a complete disruptor of addiction and that it can have a grateful impact with just one treatment. Now, I approach any new treatment with hope, but obviously skepticism. I mean, we've been promised many cures before, but we're going to dig into the research and talk about it. Hopefully, it won't be too boring for some of you. I try to keep things interesting, but I think it's an important thing to talk about, and me help provide some education about some potential options that are out there that are not fitting in the normal box. So we'll talk about what science says, the risks, the benefits, and is this something families should maybe research more? That'll be for you to decide, because I'll never tell you what you should do, but I'll definitely give my opinion. I think it's important to kind of dig into the history of how was Ibogaine discovered, because if you like history, I kind of find that part fascinating. It originated from West Africa, actually, in a tribe, and it ultimately became a very sacred plant medicine. And if you've ever read anything really about just psychedelics in general, many will say kind of how much of like a spiritual experience that it was for them. But Ibogaine is way stronger than psilocybin, which is magic mushrooms. Then you may have heard of ayahuasca. I'm pretty sure Ibogaine is even stronger than that. But an interesting story I found about how Ibogaine came into the conversation when it comes to addiction was not recent. I thought it was kind of a newer discovery to be used for addiction. But that is not the case. It was in 1962. Apparently, there was this 19-year-old who was using heroin and was experimenting with psychedelics. And somebody had said, why don't you try this, which was Ibogaine. He wasn't looking for a cure for his heroin use. Instead, he was just kind of curious. Apparently, it was an extremely long journey. 36 hours is what I read. What he found afterwards was that his cravings for heroin were gone. He had no withdrawal symptoms. And ultimately, it was described as almost like a total reset. He was really pushing for more clinical research to be done, but the U.S. ended up making it, of course, a Schedule 1, which they did with all the psychedelics, which brought funding. And so that brings us to today. We're going to break down exactly what Ibogaine does to the brain. And I'm going to put it in simple terms, not really science-based, so that you can understand. I want you to think of your brain like a forest with hiking trails, and you walk the same path over and over again, leaving ruts. And that's kind of what addiction does to the brain. It creates these deep, worn out paths that make going back to that substance easier and easier. But your brain has this really cool ability to create like new trails. And what that is called is neuroplasticity. It's basically the ability of your brain to kind of heal and rewire itself. But the problem is, addiction makes those trails so deep that the brain has a hard time being able to find new pathways. And so it just keeps going down the same one, which is kind of the cycle continues. And that's what we see with addiction. So now what Ibogaine does, what I want you to think of Ibogaine as when it comes to the brain and those trails is it's a fertilizer to help grow new trails. And once they go and they lay out that fertilizer for the new trails, they're putting a big, huge no trespassing sign on those old, deeply worn trails that continued the cycle of addiction. which allows for healthier routes to be formed. And Ibogaine it'll leave your body within 1 to 2 days. Those new pathways are still formed. So if you've heard the term that Ibogaine resets the brain, really what they mean is it's closed off those old pathways that have continued the cycle and created new ones for healing. Basically, it's giving your brain a new jumpstart. And that's where the word reset comes in, which, if this is really what is happening, that is pretty fucking awesome. Another huge fear that people have when it comes to the idea of getting sober, especially we'll use fentanyl as an example, since that was plaguing the drug supply, is withdrawal. There is a very real fear of withdrawal. And many who have gone through an Ibogaine treatment, they claim that either their withdrawal symptoms, they're completely gone within just a few hours of the initiation of it. And so to have a plant medicine that could very much remove that suffering. So that's rather a big deal, and I find that very interesting. Now, as I mentioned earlier, it's a psychedelic. So what does a psychedelic mean? You're going to see shit. You're going to hallucinate. You're going to have visions. And that can definitely make some people nervous, as I mentioned before. If you've ever had a bad trip or you've heard of someone that has had a bad trip, I witnessed it in my youth. And it's not fun. So when you're taking a plant medicine like this, the world as we know it that you see is going to be completely different. But apparently it doesn't work the same way like psilocybin does. Everything that I've read has said it's more like a dream state. Some of the stories I've read have said, many described it as almost like watching a movie, seeing their childhood in moments in their past that shaped who they are. And maybe those were really traumatic moments. And listening to this, the idea of potentially having to relive those, I'm sure is terrifying. But reliving the moments that maybe they have compartmentalized and avoided for a very, very long time, it gives them the opportunity to see clear through a different lens. And they may finally be able to understand what kind of led them down the path of addiction to begin with. And we constantly talk about coping and an inability to cope and even the why. People who need to work through trauma, some have a real hard time agreeing to that because they don't want to reopen those doors. When you're just talking, you're going to get an hour with a therapist and it's going to end. That is not enough time to really dig deep into trauma. So that can be a very long and slow process. But with a psychedelic such as Ibogaine, you can go and you can have an experience, as I like to call it, and be able to work through that shit maybe over a weekend. So I guess the whole experience can last anywhere from 18 to 36 hours, which, damn, that's a long experience, but you wouldn't be doing it alone. To have the opportunity to get to the root of what's driving your addiction just over a day or two, that can be a complete game changer. Okay, I'm going to read from my computer for a second, just as far as the studies. There's no way I can process all of this, so bear with me. Let's see, in 2022, a team of researchers looked at 24 different studies on Ibogaine. There were over 700 people who had taken Ibogaine, and what did they find? It helped reduce withdrawal symptoms and cravings. It also seemed to help with depression and trauma symptoms. But in that same review, it does state that there were reports of serious problems and even deaths connected to Ibogaine. Then there was a study from New Zealand, and in that study, it was small. They followed 14 people who received Ibogaine. They followed them for a year, and at the end of a year, what they found is overall these people were doing substantially better. So that's very promising. And then another significant study, and this really might mean something to some of you. There was a study done by Stanford that followed veterans who had a traumatic brain injury and PTSD and depression and the impact that Ibogaine had on them. And of the group that they did the study on, it says that 23 of them had PTSD, 19 had thought about suicide, 7 had actually tried to kill themselves. They ended up going to a clinic in Mexico where they then took Ibogaine, and apparently the results were amazing. Their PTSD went down by 88%. Depression went down by 87%, and anxiety went down by 81%. Sign me up. This lady has lots of anxiety and could benefit from that. It says that before treatment, these veterans had significant disabilities, and afterwards, there were none found. I guess one of the researchers had said that they've never seen a drug that's had that kind of impact on somebody with a traumatic brain injury. So, all of those things right there, very promising. Now, with good, there's always bad. We have to talk about it. I'm going to be transparent and I'm going to share my opinions, but what I am sharing with you is from research because I have no experience with this plant medicine. Apparently, the biggest risk with Ibogaine is cardiac issues, so heart issues. And what I could find, there had been deaths because of that. The research had said that these were healthy individuals, had never had any cardiac history prior, and they experience a cardiac arrest. Now, one of the things that was mentioned is I think some of these clinics, they're loading them up with magnesium, which impacts the heart. So maybe they have found that that helps suppress these issues. That is still unclear. But one of the things that they found that puts people at increased risk, I guess, of having one of these events is a low potassium, obviously a lower magnesium. And these are actually all things working in critical care. You better believe you're getting those checked often and you're getting a lot of replacement. Most people, I find, their magnesium levels are too low. And so we tank you right up. And I think when you have younger people going and taking this medicine, many times, right, you've compensated. You don't even recognize that maybe you have some type of heart condition. And so that can put you at increased risk and then potentially any other medication. So you would hope that the clinic, if it was something you were going to seek out and do, that they would be doing extensive research and wanting to know all the medications you take, checking, your potassium, your magnesium level, all of those things, and ensuring that they're going to be at an appropriate level before they even consider approving you to get the treatment. Medications in general come with risk. And when you have a medication that hasn't been studied significantly, there's even more risk with that. So automatically, my thoughts would be that you don't want to go to some shady place. You would want to do your research. You need to be connected to a cardiac monitor so you're monitored at all times. They should check your labs. If a place doesn't do those things, I would not select that place. That's my opinion. But to me, just reading the risks that are involved, those would be the appropriate interventions to have in place so that God forbid, if something was to happen, it could be caught early and responded to. And if you've ever heard the term purging when it comes to like ayahuasca, because it is such a strong psychedelic, it's not uncommon for people to throw up and poop at the same time, is my understanding. That sounds pretty traumatic in itself, but then other people say it's such a huge relief, like a demon leaving them. As my husband says, and it fits in perfectly, take a chance, shit your pants. And then obviously, as mentioned earlier, you're talking about one of the strongest psychedelics that's out there. And if it is putting you in a dreamlike state and it's going to expose you to some very past traumatic events, I think you just need to go in mentally prepared for that because that can linger for a while. But I do believe if it can help you in the long run and heal, it's worth just working through that shit right then. I know for me, I'm really kind of interested in doing it myself. I find it very fascinating and working through my trauma. I've healed a lot, but it'd be really nice to just kind of work through everything. I'd rather just get it over with and know that afterwards I'm going to be in hopefully a better place. So what makes Ibogaine different when it comes to treating addiction versus medicated assisted treatment? Well, you're going to have to continue to take those medications and you will experience withdrawal if you were to just suddenly go off of them because, well, your body becomes dependent on it. The difference with Ibogaine is it breaks the addiction itself with those new trails that we talked about earlier. But this is the really important part. Ibogaine is not a cure. People still are going to need therapy. They're going to need some type of aftercare. And I never even knew aftercare would have been a thing if it wasn't from Justin in AD Detox, because I guess he used to run like a post Ibogaine clinic. He doesn't do that anymore. And I've read that actually even about ayahuasca as far as kind of like the re-entry back to reality. There needs to be a level of support through that and kind of reintegrating back into normal everyday today life after having such a powerful and really probably life-changing experience. So the question is, where is Ibogaine legal? So Mexico is the most common place that I've heard of, but there's absolutely no regulation at all. If you were to consider going that route, you definitely want to do your research. And apparently Canada can prescribe it, but many doctors don't. So it's actually pretty limited. It looks like it's New Zealand, Brazil, and South Africa. Now, I have heard that there are places in the US that is doing it, even though it's not legal. But I don't even know what places those are. But as always, when you have something that is not being regulated, you just want to be mindful of where you're going to send your loved one to do it, or you're considering doing it yourself, because you want to be with a professional just in case something goes wrong. You're going to not want to just take the medication for an experience, but have, I think, a level of guidance and therapy through it. So absolutely do your research. And in regards to families and how you approach this new information that I've given you, I know the desperation of wanting to help your loved one. I absolutely do. And if Ibogaine is something you're considering, I want you to do your own research. If you hear of a clinic, I want you to dig into it. Dig into the Reddit boards. As much as I hate Reddit, get online and start learning as much as you can and research the risk and benefits and determine on your own if you think it's something you want to try. Because as we know with like addiction treatment industries, you can look at a website and it could be like a wet dream. But the reality is that they could be completely full of shit. So dig deep, especially considering a plant medicine that is this powerful. And then you want to ask about what aftercare looks like. That's with any program. So when they're done with this, do they help? Do they have a plan? Do they have groups that might be online? Because obviously you're not just going to go stay in another country, to help kind of with that reintegration process or what they recommend. Just know you're going to have, a plan and what that's going to look like afterwards. And please, for the love of God, when you fill out that medical questionnaire, be honest, especially with the cardiac issues that's involved. Be honest. I think it's promising. Just off of everything that I have read and studied. And like I said, yes, there are people that have died from it, but there's risks with any medication. So what's my opinion? I think it has real potential. I mean, the research that I found shows that. So I think it's something that you may want to look into. The one thing I know is that we need more options for addiction treatment. We need alternative options. And because we have to be able to get to the root of the issue. The drugs really aren't the problem. It's what they're trying to numb, what they're trying to escape that really is. So if you have these plant-based psychedelics that can help create those new trails and pathways in the brain for healing, it could be a game changer. And the takeaway from this episode is for me to give you information that I've researched and I've learned, and you then take it, do your own research, and make your own informed decisions. And then, of course, we need to talk about what everybody wants to know. The main thing is, how much does it cost? Now, from what I could find, is usually if it's, say, a 7 to 10 day stay for the Ibogaine treatment, it can range from anywhere from $5,000 to $25,000 and probably even up from there. That's going to be dependent, I think, on the facility and all that's involved. Cheaper doesn't always mean better. So you're just going to have to ask the right questions and do your research. And if you like this content, if there's something you want to learn about, please drop it in the comments. Email me at Brandi, Brandi, at brandymac.com, and let me know. If you have done Ibogaine, I would love to hear your story, and I can share it on another episode because I know other people would love to hear that also. And I appreciate you guys listening. Take care.